Welcome back. This month we're celebrating National Self-Care Day, and joining us today is Dr. Christopher McCann, a gynecological oncologist at HCA Florida, JFK North. Welcome, thank you so much for being here.
Thank you for having me.
So why are these yearly visits so important for women?
Well, really it's about preventative health. We do a good job of screening for cervical cancer with pap smears, and the other thing is breast cancer screening as well, and also addressing any problems you may have with your menstrual cycles, pelvic pain, abnormal bleeding, that sort of thing.
And doctor, you see women who are dealing with cancer. How do visits like this, how does this preventative care help in trying to catch that early?
Yeah. So the main cancer that we screen for is cervical cancer. And by doing pap smear screening, we're able to identify precancerous lesions before they may turn into an invasive cancer. So that's important. The second thing is, the most common cancer we treat is endometrial cancer, and so women who have abnormal bleeding after menopause gives us an opportunity to identify those women, and by identifying them, find them at earlier stages and more amenable to treatment.
And what are some symptoms that women should be looking out for? Because I believe some of them are minor, right? So you maybe think it's nothing really.
Yeah, that's a difficult question, because for ovarian cancer, there isn't really a great symptomatology that comes along with it. Bloating, early satiety, feeling hungry with eating little, pelvic pain. Obviously, any bleeding after menopause is abnormal and should be evaluated.
Okay, all right. And how young are we talking about for women to be going to these yearly visits?
Yeah, I mean, a lot of people recommend around age 13 to 15. That's when you're going to start talking about starting your menstrual cycle and menstrual irregularities. Pelvic exams are performed, and a lot of that can be done by a pediatrician. Most importantly is at age 21, that's when we start screening for cervical cancer with pap smear. So if you haven't seen a gynecologist or someone who does a pap smear by that time, then you should find someone.
Remind us again, because the guidelines for pap smears kind of changed a few years ago.
Yeah, so now we start at age 21, whether or not you've been sexually active. And although the screening guidelines have changed to every 3 to 5 years, you still need to see your gynecologist once a year for a pelvic exam, because there are other things that can be picked up.
And is that 3 to 5 years for every age, or is that a certain age? Like after we hit a certain age, should we be doing it every year?
Yeah, we don't do yearly pap smears anymore, so it's every 3 years, especially ages like 21 to 29. And then depending on age will depend on what test we may order. But it's usually every 3 to 5 years.
What do you want to let women know who maybe have not had, the chance or maybe the insurance to be able to go get these yearly exams? What message do you want to send to them today?
Yeah, it's never too late. Once you get in, you can get plugged back into your preventative health. It allows you to plan for your future, because if you stay healthy, then you can plan for a future that's meaningful.
Doctor, put it in perspective for us. So let's say, I'll throw myself in this example. You go get your yearly exam, everything is fine. You develop cervical cancer in that 1 year before going over for your next yearly exam. What are we talking about there? Stage 1, even possibly less?
Yeah, that's unlikely, because the timeline for developing a cervical cancer, even from a high-grade precancerous lesion, is many years.
Okay.
So it's unlikely over a year that you would develop cervical cancer. But if you ever develop any symptoms that may worry you, you have to advocate for yourself. And so if you ever develop any symptoms that may worry you, discharge, bleeding, anything, pain, you should see somebody sooner if you're not due.
And even if you do get it in that timeline that you just said, there's still a lot you can still do for it because you caught it early, would you say?
Yeah, most of these are caught early and are very treatable with just surgery alone.
Great. Thanks so much, doctor, for being
You're
here.
welcome.
If you'd like to watch this information, or watch this interview again, and for more information, head to our website, WPBF.com, or download the free WPBF 25 News app. Erin.
Always good information.